For me, it would be don't look back. It's going to be the best and hardest thing you've ever done, but I've never known anybody who regretted it. Particularly, I would opt to do it Rosemary's way.
Yeah.
Don't wait for the diagnosis.
Right.
But you'll never regret it, and it is hard. My name is Anna. I was diagnosed 3.5 years ago with breast cancer. And on the basis of my diagnosis, we're both BRCA. Breast cancer runs through our mother's family. I did chemotherapy, which thankfully worked really well. Had a double mastectomy with deep flap reconstruction, and then radiation.
Summer of 2015, I was tested genetically for BRCA and came back positive. And just from day one, I think knowing that I had the BRCA2, you almost feel a little bit labeled in a group. And then knowing that you have to decide what you're going to do with it. So
take two sisters who are going to support each other unconditionally with unwavering dedication, but they've had two different journeys. You've got Anna, who's had chemotherapy, radiation, surgery, and you take Rosemary, who has the BRCA gene, who doesn't have breast cancer, who's doing her surgery for entirely preventative purposes.
For me, we didn't know anyone else, so there were no expectations.
And the one thing that's made it work for them is that they've never compared their experiences. When we meet with patients, we tell them to seek the support of others, but don't compare your journeys. Just because a patient that you talk to had a complication doesn't mean you're going to get it.
And you just don't realize how long it takes your body to heal, especially if you don't see it.
Factors are different for different people. Risk factors are different for different patients.
You know, everybody gets different issues with the surgery. With the deep flap, I couldn't stand upright for a couple weeks, and for some reason my back just really hurt after the surgery. I would recommend building contacts before the surgery. People that could check up on you, people that could help you go places, people that could possibly even, bring you groceries.
We're concerned with the support they're going to get, the loved ones around them, from their friends. We care about their functional outcomes.
I would opt to do it Rosemary's way.
Yeah.
Don't wait for the diagnosis.
Right.
But you'll never regret it, and it is hard.
Definitely a hard choice, but I feel fortunate that I did get to make the choice. It wasn't made for me. At this point in my life, I really felt like it was the best decision to make, and just knowing that I don't have to deal with that in the future. So I'm happy about that. I'm happy about my decision.
That the breasts, they're not substitutes, they're not poor facsimiles, without getting too detailed. I feel very normal.
No, I feel the same. That's in my mindset. I wanted to come out of it feeling the same way I did going into it.
And that really the key to the success has been this teamwork, not only between myself and the patient, but the patient and their family, the patient with other patients in the form of support, and the patient with everyone else on this team that makes it possible.
Support is huge when you've been diagnosed with cancer or when you're thinking about moving forward with a major reconstruction surgery, even if it's something you're doing prophylactically to protect your health. So find support, whether it's support within your family, within your community. We have patient advocates who are more than happy to speak with new patients coming in, so you know what to expect. Surround yourself with people, whether it's your family, friends, coworkers, other women in like situations, to help lift you up and get you through this journey as a team.